So let's break that up a bit. The term bilateral in the case of ears means both ears. Impacted means that it's pushed in. It's the best analogy I can give. You imagine on the seaside, you've got your bucket, you've got your spade, and you dig up some wet sand, you place it into the bucket, you get the spade and you pelt it into the bucket. So that's impacted. Occluded is when the wax or dry skin creates a complete seal of the ear canal, so there's no air, or the eardrum can't see any daylight. Medial means towards the eardrum, which is what's going on in this case. So you can see it's really deep. You can see where the cotton bud, the Q-tip, so patient's guilty as charged, they use the Q-tip here, and you can see the mark just to the right, the indentation. I had to put some drops in just to loosen this plug of dry wax and skin. Patient has got a bit of eczema of the ear canal as well. You'll see that not only in the patient's left ear, but also the right ear. So if you stay tuned, you'll see the patient's right ear. And we're just trying to lift this off the canal wall. It's strongly adhered, so we just want to elevate it. So I'm just lifting it off the anterior canal wall. This is the front part of the ear canal. I'm giving it a little wriggle there. So I'm doing this whilst the drops is in the ear. I find that's a bit more effective. It can be a bit more tricky because you can get a bit more blurring because as you're suctioning, you're also suctioning the oil. I've created a little opening there, just enough where I can insert the jaw, so that this is the top jaw of the crocodile forceps to the left. I can glide it in between the dry wax plug and canal wall without making contact. Previously, because it was up against the canal wall, if I were to glide that top jaw into that space, I'll be rubbing the bony part of the ear canal. However, it's really, really lodged, so even with the forceps, it's quite tricky to remove. Because I've created that opening, I'm now gone in with an ear hook. We have to be so delicate here. You can see I'm just gliding it to the front part of the ear canal, rotating the hook clockwise, trying to get some purchase, but it just sliced through it like a hot knife through butter. Just therefore going back with the suction probe, I want to lift this back up again. I think I'm going to go to the back part of the ear canal in a moment because the oil's loosened this slightly. You can see with the oil, the skin is almost coiled and turned. So that kind of curls it off the canal wall and it enables me to use the suction, just trying to peel this dead skin. You can see that's keratin there. It's a fresh layer of keratin because it's quite glossy. Again, because I've created a bit of an opening, I'm now going to try and insert the bottom jaw of the forceps behind. I'm going to just lift this forwards. Ultimate requirement here, steady hand, and we just want to avoid contact with the canal wall. And from the back part, when I got that grip with the forceps, I managed to remove it. You can see this patient's ear canal, it goes really steeply upwards, and then near the eardrum at the isthmus, the narrowing, it slopes down. So the ear canals are really steeply inclined. This is the same patient, this is their right, and now this isn't as impacted, it's not been pushed in. So what we're seeing here is the surface of the wax and dry skin plug, and it's more lateral, so the term lateral means more towards the entrance. And you're going to see me use microsuction. This is a standard Zollner suction probe, an ear hook and some forceps to remove this. Whilst just watching that, I'm just going to go through some questions from yesterday. Someone was asking yesterday when I was peeling off the dead skin off the eardrum, would I be able to do that without the eye clear scope? I would be able to do that with an operating ENT microscope, but that's about it. Any other visualization techniques like loops, or there's some other otoscopic devices out there, it just wouldn't be safe. So when you're working off the eardrum like that, for me, it's an operating grade ENT microscope or the endoscope, the eye clear scope, which is what we developed. I hope that answered that question. Someone asked what the white flaky thing was in yesterday's video. I'm not sure what the white flaky thing was myself. I'm not sure I saw any white flaky thing. I did watch the video back, couldn't see any white flaky things, so maybe it's the wrong video the patient's commenting about. Someone suffering from eustachian tube dysfunction has just been advised to use nasal decongestion spray. There are other things that can be done. Otovent nasal balloon. I think I've mentioned this quite a few in my previous videos, some of these questions, but also the ear popper. You can see an ENT doc to get referred, possible of grommets which are ventilation tubes to help with eustachian tube dysfunction, or eustachian tube balloon dilation is when they surgically widen the eustachian tube. See that big wax plug there removed with the ear hook. See the patient's eardrum. So this ear canal is not as steeply inclined. It still does go up a bit more than the norm. There's a bit of tympanosclerosis scar tissue on the posterior part of the eardrum. You're just going to watch me now peel away a lot of this dry skin the patient's got. I'm going to remove as much as possible. It's not going to migrate on its own accord. I'm going to use some forceps, I believe, as well. You'll just see me delicately peel this. Someone asked whether it's safe if they can use some of the tools that we use themselves in their own ears. The answer is no. What we do is very specialised, and you can't do this safely yourself at home. This is your ear's very sensitive. It's very narrow, contorted, twisty. So please, guys, don't do anything silly. I must plead with you. Someone wanted to know what can be done with olive oil drops. So there's just a final view of that ear. You're going to see some still images there. Avoid water, don't poke in your ears. I know it's an urge to scratch and itch, but in the long term, you're just going to make that worse. Over-the-counter, stuff like ear calm. However, if this doesn't work, your GP needs to either prescribe you something else or refer you to see a dermatologist or an ENT specialist, possibly have some blood tests done to check for any allergies. It could be that you're premenopausal or menopausal. There's a big link there. If you just check that there's no humidity in the house or where you work, because that can cause itchiness in the ear. But short and long of it all is just to go to see your doctor about it again and keep insisting for referral to dermatology or ENT. Someone's been experiencing vertigo and wanted to know the GP's referred for blood tests, etc. and scans. With vertigo, it's a whole topic. I mean, people spend years getting trained in vertigo, and it's not a short answer. I will just get all the available tests done, whether it's scans, and I would try and get referred to ENT as well, possibly, for balance assessment. But it's very difficult to answer that because there's many plausible reasons and probable reasons for dizziness. But yeah, your ears can be part of the problem, and it can happen spontaneously. But yeah, I'm sure the GP's doing the right things, testing everything in the right orders for you. There's a few requests for my colleague Mr. Rajali's YouTube channel. If you just type in Mr. Rajali or Darius Rajali, Darius Darius, Rajali Rejali. I will put the link up as well, but if you just Google that ENT, I'm sure the link will come up there. Someone wanted to know whether I've ever seen cases where people develop a reaction to the material used, hearing aids, for example. Yes, that's possible. Hearing aids are made up of hard acrylic, typically, or some sort of other plastic, which can cause reactions. So there is hyperallergenic materials used as well. So Microflex, for example, which is a type of silicone, non-allergic. So yes, it can happen, but there is ways, hopefully, we can mitigate that. Someone wanted to know the typical sensations experienced by a patient when removing stuff like keratin wax near the eardrum. So a lot of relief, but I think it's the noise that can surprise them the most. Probably a little tickle, hopefully no pain if we're gentle. But patients tolerate it really, really well. Someone had a question about tinnitus, and they listed many things, asked whether it can be the potential cause. Yes, anything can be a potential cause of tinnitus, believe it or not. With regards to treatments of tinnitus, that's a whole big topic there. We don't be able to advise until we've treated someone, but find a good local audiologist who has a specialism in tinnitus. I'm sure they can assist you. Someone wanted my opinion on some of these devices available for earwax removal over the counter. I've answered this in the previous video as well. They're terrible, stay away. Someone wanted to know how to stop water in the ears when they go swimming. You can get swim plugs over the counter, or indeed custom swim miles from your audiologist. Someone wanted to know how soon after having swimmer's ear is it safe to go back into the water. So first of all, make sure your infection's cleared, so go back to your doctor, get it checked. I know a lot of ENT would probably say 6 weeks. 6 weeks is a typical healing time, a really comprehensive healing time. When you do go back, make sure your water doesn't get in your ear. So swim plugs, just going back to the previous question and the answer there. You can get custom ones or foam ones or silicone ones. So yeah, just be careful though. Don't go back too soon. You want your ear to be completely clear and infection resolved before you re-embark on swimming. Someone asked about the granulation tissue and what can typically happen. Does it kind of migrate on its own accord? Granulation tissue, ideally you don't want there. Hopefully with medication it can resolve. If it doesn't and it's constant in the ear and it's weeping, ENT can cauterize it using silver nitrite, and you kind of almost burn that granulation tissue, and you encourage the regrowth and the healing to start all over again, and hopefully that time without any granulation tissue. I've kind of had another comment about lightening up a bit and being a bit funny in the videos. So I never started my YouTube channel to become some famous person like Dr. Pimple Popper. It was purely educational. It's just to, when I first uploaded my first video about ears on my YouTube channel, I didn't even look at the number of views. It was just if people wanted to get treatment performed, they can have some inside knowledge of how it's done. So I didn't create the YouTube channel to become a celebrity in any way, or, I want my work to speak for itself. So I crack a joke during the video, explain something, and it's spontaneous, I'll do that. But I'm not gonna, it's not the purpose of my channel to, trying to be a comedian or trying to be funny and trying to gain viewers and subscribers that way. It's not the purpose of it. There's loads of other channels out there that are designed for that. I'm going to be true to myself. I'm going to do what I do. I'm not going to change in any way. It's a bit upsetting reading those kind of things, because this is an earwax removal educational channel. It's not. I'm not here to crack jokes, and I don't understand it sometimes. I really get confused, and it is quite frustrating, because I'm just doing earwax removal, guys. I've not got a degree in comedy, and I'm not here to crack jokes. I'm trying to provide a professional service, and sometimes I kind of disagree with that. I do think I sometimes, just through explaining stuff, I kind of crack jokes. Yeah, I hope no one gets offended by that, but it's not the purpose of my channel. I think I've spent a lot of time explaining that, and I want to just see if there's any more questions to answer. However, I'm just going to come back on that point, because I think a lot of people are asking about my personal life. I want to keep that separate. Personal, obviously, it's my personal life. I don't really want to kind of, discuss too much about that at the moment. Again, that's my own personal life. The issue is as well, I've had a lot of people stalking me as well, on social media, and, personal messages being sent, and I've been made aware of certain Google searches about me as well. And I just want to keep my personal life separate, and I hope people can appreciate and respect that. Again, I'm aware now that I have become quite well known in my field, but I want to have a bit of control over my personal life, if that's okay. And again, I just want to come back to that point. I hope no one feels offended when I say that. I appreciate all your support. I appreciate, people watching my channel, but at the same time, I don't want that to then be a reason where people feel that, I have to disclose stuff about myself. And I have spoken about myself in the past, in certain videos, when it kind of related to the video in some ways. For example, I remember I used to get criticised a lot for not doing talkovers, and I had to then explain that actually growing up I had a stammer and I had a stutter, and occasionally I always worry about that. So I have mentioned stuff like that, but there's some things that I don't want to discuss at the moment about my personal life, and I hope that's okay. And I don't know why I'm saying I hope that's okay, because that's my choice and I shouldn't be asking for anyone's permission almost. But I just want to keep my professional and personal life separate. I think that's really the best way to go about things. Well, I think that's